Hello, this is Dr. Reilly. I'm going to talk to you today about pediatric PCOS. This is the third video in our series, and this one is going to be about the medicines that doctors use to help control PCOS, or at least what we use. So, again, PCOS, one of the most common endocrine abnormalities, if not the most common that we see in ladies, and it's something that we need to get a handle on. Now, certainly, it's the kind of thing that when we look at the medicines, we're going to see that all of them have importance in terms of oxidative stress. Oxidative stress is what's kind of produced inside your body when you're having things like inflammation, and all the medicines that we're going to talk about actually have value for that kind of stuff. So when we look at what causes PCOS, we see that PCOS has at its root a lot of things that that we can manipulate, and that is insulin, and androgens are just a fancy name for just some of these hormones and genetic factors. Obviously, we can't really change the genetics, but we can actually alter the way that they're kind of expressed. Now, one of the things that's actually kind of key is to realize that the liver actually has a lot of function in terms of what's going on with our hormones. So we have to always keep that in mind. And you're going to actually see that as we talk about some of the medicines, some of them actually are going to be popping up in our videos regarding liver issues that people will have. And here we just have in this slide just a little bit of a quickie blurb about how the liver actually produces sex hormone binding globulin, which is one of the things that are very key. In fact, it's probably the first thing that I see in kids as they start walking down this path to having PCOS. So metformin is wonderful for PCOS, and it really is probably the first thing that we end up using in terms of medicines because it's safe and it has actually a lot of different salutary kind of effects. So as you can see, I put in a few different articles how it's good for things like PCOS, and it seems to actually prevent people from getting, cancers. It also seems like it's good for acne, and it has its effect by telling the liver to produce less sugar. But it also has, because of that, it helps to become like an insulin sensitizer. And insulin is the thing that, if you remember, is one of the things that drives inflammation, and inflammation is at the heart of PCOS. So one of the things that we see is that when we start giving girls metformin, that it seems to actually have a very nice effect in terms of helping to prevent the symptoms of PCOS. And in a like manner, acarbose. So acarbose might be something that people are not familiar with, but it is actually something that's good for PCOS. And it works also in the same way. So we just said that metformin helps by telling your liver to stop producing sugar. Acarbose actually works by telling your intestine not to absorb sugar. And since sugar is at the root a lot of these kind of problems, it actually is something that has a very nice effect. And as you can imagine, it has a very nice effect in terms of helping to lessen the symptoms related to PCOS. And I find that actually I can get away with using lower doses of metformin if I use a low dose of acarbose. Now, metformin and medicines like that, they help to lower your insulin. So they're especially useful in ladies who are starting to show insulin resistance. The same for acarbose. So it is actually something that we can actually schedule the acarbose to be given during meals, especially that we know that we're having problems avoiding sugars. So like a very typical example would be that the family is a large family and everyone in the family lives for their pasta or rice or something like that, so that it's unavoidable. The kid is going to be exposed to these two foods, which are basically sugar. And how are we going to decrease the amount of sugar that the kid absorbs? Well, we can always add on some acarbose Now, acarbose can actually have a side effect if you eat too much sugar while you're taking the acarbose, and you're taking a higher dose of the acarbose, that you will have plenty of gas kind of side effects. But it otherwise is extremely safe because almost none of it is absorbed into your bloodstream. And medicines like that, that almost never are absorbed into your bloodstream, tend to be actually some of the safest medicines that we use. Metformin is also very safe. It's probably associated with a little bit more stomach upset, and it is something that it can actually lower our body's vitamin B12. So it's something that when we use it, we're always monitoring the B12 levels. But both of these medicines are super duper safe, and metformin, it seems like, is on the road to being approved for as an anti-cancer kind of treatment. So you can't get much better than that, right? When a parent asks you, what are the side effects? It's like, oh, side effects, less cancers, things like that. Spironolactone is another medicine that it's actually a blood pressure medicine, but it has this salutary effect that it actually helps your body to stop producing testosterone. And this is actually very good for girls when they're having too high the testosterone. And it's used a lot of the time. I see dermatologists giving it to their patients because the testosterone that we see in the PCOS causes acne to get worse. And one of the things that is actually going to help to lower your testosterone would be spironolactone. Unfortunately, it works really, really well at stopping testosterone from being produced. So if someone is pregnant when they are using spironolactone and they're pregnant with a male, then yes, then that boy is not going to have all the different hormones that they're supposed to have, because it's going to pass through the placenta into the child, and they're going to have issues. So because of this, it doesn't reach a top spot in terms of safety, although really it's only in kids who are getting pregnant who have to worry about this kind of stuff. So certainly some of my younger kids, I don't have to worry about it as much, but it is something that it's out there, and we do have to worry about that. But certainly when I've given it to people, I don't see really they have hardly any side effects at all. And if anything, it helps to lower their blood pressure, which you might expect also would be having good effects for them. And then there's the pill, which I put this a little bit down on the list just because, well, personally, I've never prescribed it for anybody. I usually leave that for someone else, like one of the endocrine specialists or the OB/GYN. And part of it is because although it's super effective, and definitely we've had kids who had such severe hormone problems that it was the only thing that seemed to help them. Just the only thing is I don't find it to be as safe. And I since I almost never prescribe it, I'd prefer that someone else who has more familiarity to prescribe it. Usually it is the kind of thing that part of the reason why we're a little bit hesitant is because of these kind of issues that that it seems like it can definitely set ladies up to having clots, and it does kind of have this kind of differential effects on cancers, where it seems like a little bit more breast cancer, a little bit less uterine cancer, ovarian cancer. But as I show in this other graph, breast cancer is like so much more common. It's hard to say what is the cost benefit ratio, and because of that, it is something that gets us into trouble. Now, certainly part of its good effects in terms of endometrial cancer is probably because people who are getting it actually are the people who have PCOS. And since we have other medicines that are safer that prevent other kinds of cancers, wouldn't we want to use those first? Now, certainly if you're using it to prevent birth, then that's a useful indication. The next two slides are not really very well known indications for medicines, but I just wanted to put them in. The first one is thyroid problems. And one of the things that we're starting to learn a lot more lately is that there is definitely a link between having like seemingly subclinical thyroid kind of problems, but it's actually driving the PCOS kind of problems. So this is definitely something that we always are going to look at. Like, does the kid have any kind of issues related to their thyroid hormone? Because if they do, then we're going to have to take care of that, or else we're going to be trying to give the wrong kind of medicines for something that the kid is suffering from, from their thyroid. And the last is something that I'm wondering if is going to become much more common in my toolbox later on. Now, this is liraglutide, and certainly Saxenda was just approved for use in kids for weight loss. Now, one of the things that we see is that as women lose weight, their PCOS gets better. So it sort of makes sense that if you give them medicine, that this is actually, that's going to help them to lose weight, that this is actually going to have an effect on PCOS as well. And it does seem like this is something that we're seeing. Now, it's not approved for this indication, but certainly for that subgroup of girls who are having PCOS and having a BMI greater than 30, this actually would be something that would be a sort of side effect of the weight loss, would actually be that the PCOS should get better. Now, this is also associated with side effects. And yeah, I haven't seen really too many pediatric patients where we've given this to. And but it is definitely something that works, and it's probably the medicine that works the best in terms of helping to lose weight. So, but it like I said, it's a little bit like on the back burner. It's definitely, when you look at the different kinds of medicines, metformin far and away the safest and the thing that's been used for the longest time, and probably the first line. And for me, with a low dose acarbose, is definitely the first line kind of medicine that I'm giving for kids who are having this. Now, this is the last in the series. I hope you liked it. If you did like it, then I want you to like and subscribe, because this tells Google that other people who are not lucky enough to go to RBK can actually find out about these kinds of things, or even pediatricians, because, before I actually taught myself a lot of this kind of stuff, I was looking for information on the internet. I would have loved to have this as a reference point, and it would have helped me to actually be able to put out these videos much faster if I had some place where I could look all this kind of stuff up. So yeah, so if you're having any other questions, then certainly, it is definitely something that we're available for our consults if you're having issues related to the PCOS. And don't forget to like and subscribe.